Hello everyone, I'm Dr. Sophie Caldwell, and over the past 30-odd years working in urology here in London, I've had more conversations about men's health than I can possibly count. Now, I know what you're thinking. This is going to be awkward, isn't it? Well, perhaps a bit, but here's the thing. In the last 5 years alone, I've seen a massive increase in chaps coming into my consulting room asking about sperm accumulation. They're worried, sometimes embarrassed, and often they've been Googling symptoms at 3 a.m, which never helps, does it? So today, I'm going to talk to you straight about what actually happens when sperm accumulates in the body. We'll cover the causes, the symptoms, what you need to worry about, and more importantly, what you absolutely don't need to lose sleep over. I'll also share some practical solutions that I've recommended to hundreds of patients over the years. Right, let's get stuck in. Now, before we go any further, let me tell you about a patient I saw just last month. I'll call him Robert, not his real name, obviously. Robert's 62, married for 35 years, and he came into my office looking absolutely terrified. He'd been experiencing some discomfort and was convinced something dreadful was happening. After a proper examination and a good chat, it turned out he'd simply been dealing with the effects of reduced sexual activity combined with some anxiety about getting older. He's absolutely fine now, by the way, and he wished he'd come to see me months earlier rather than working himself up into a right state. Robert's story is surprisingly common, and it's exactly why I wanted to make this video. So many of you are dealing with this quietly, not knowing whether it's normal or whether you should be concerned. So, what exactly is sperm accumulation? Well, it's quite straightforward, really. Sperm accumulation occurs when a man doesn't ejaculate regularly. This can happen for all sorts of reasons. Perhaps there's less sexual activity than there used to be. Maybe there's no partner at the moment. Or it could be due to medical conditions or psychological factors that make ejaculation difficult or impossible. Now, here's what's brilliant about the human body. It's got mechanisms to deal with this situation. In most cases, not ejaculating regularly won't cause any serious complications. Your body is remarkably clever at managing itself. However, if the accumulation is accompanied by physical or psychological discomfort, that's when we need to take a proper look at what's going on and address any underlying causes before secondary problems develop. Let me explain what can cause this accumulation in the first place, because understanding the why is half the battle, isn't it? There are several factors that influence how often ejaculation occurs, and they're not all physical. Many people abstain from sex for personal, cultural, or religious reasons, and that's absolutely fine. Everyone's different, aren't they? But there are other factors too. Decreased libido can be caused by hormonal imbalances, stress, or simply getting older. And let's be honest, the pace of modern life doesn't help matters. When you're knackered from work, worried about bills, or looking after elderly parents, sex isn't always top of the priority list, is it? Psychological factors play a huge role too. Anxiety, stress, depression. These negative emotions can seriously affect your ability to maintain and enjoy healthy sexual relationships. I've had patients who've developed what we call performance anxiety, where the psychological pressure becomes so intense that they start avoiding sexual situations altogether. It becomes a vicious cycle, really. Then there are the medical conditions. Prostatitis, which is inflammation of the prostate gland, can make ejaculation difficult or painful. There can be physical blockages in the vas deferens. That's the duct that carries sperm. And there's something called retrograde ejaculation, where the sperm doesn't come out at all, but instead goes backwards into the bladder. That last one sounds alarming, but it's actually manageable with proper medical care. Right, so what actually happens in your body when sperm accumulates? This is where nature's quite clever, really. Your body has developed mechanisms to cope with this situation. The seminal fluid can be reabsorbed by the body and broken down into its components, proteins, enzymes, and other nutrients. It's a completely natural process, and you're not losing out on any nutritional value, despite what some dodgy websites might tell you. However, if there's no ejaculation for an extended period, you might experience some mild symptoms. There can be slight discomfort in the testicles. Some people call it blue balls, though that's not exactly a medical term. You might have nocturnal emissions, which are spontaneous releases during sleep. Perfectly normal, by the way, even for older men. And there can be mild swelling of the prostate gland. Now, let's talk about the symptoms that might concern you, because while some men don't experience any problems at all from sperm accumulation, others do notice changes that affect their well-being. The buildup of pressure in the seminal ducts can cause pain or a feeling of heaviness in the testicles. Some men experience general discomfort due to muscle tension or inflammation of the prostate. There might be reduced erections or decreased libido, though this is often caused by psychological factors rather than physical ones. Your mind and body are connected, aren't they? And in cases of sexual dissatisfaction, there can be irritability or mood swings. I've had patients whose partners noticed the mood changes before they did themselves. If you're experiencing any of these symptoms persistently, that's when you should come and see a urologist. Don't sit at home worrying about it. We've seen it all before, and there's no need to feel embarrassed. So, when does sperm accumulation become actually dangerous? Well, I don't want to alarm you, because in general, sperm accumulation doesn't pose a serious health risk. Your body's designed to handle this, but in some cases, it can contribute to other problems. Chronic prostatitis is one concern, particularly if you've got a history of repeated infections. When sperm accumulates alongside existing prostate inflammation, it can make matters worse. There's also sexual dysfunction that occurs when the accumulation is linked to hormonal or psychological imbalances. And urinary tract infections can become more likely with long-term semen retention or retrograde ejaculation. You should see a doctor immediately if you're experiencing persistent pain or significant changes in your sexual or urinary function. Don't mess about with these things. Early intervention usually means simpler treatment. Let me tell you about another patient. I'll call him James. James came to see me about 18 months ago. He's 73, widowed for 5 years, and he'd been experiencing quite severe discomfort. He'd convinced himself it was prostate cancer. He'd lost his best mate to it a few years back, and he was terrified. After a thorough examination and some tests, it turned out he had mild prostatitis aggravated by long-term semen retention. We got him sorted with some anti-inflammatories, discussed some lifestyle changes, and explained that regular ejaculation, whether through masturbation or with a partner, would actually help. He was relieved, to put it mildly. Sometimes just knowing what's going on and that it's manageable makes all the difference. Right. So how do you avoid problems with sperm accumulation? I've put together some practical advice that's helped hundreds of my patients maintain their sexual health and avoid the discomfort that can come with sperm buildup. First and foremost, regular sexual activity helps reduce sperm accumulation. And if you haven't got a partner, or if your partner's not interested, masturbation is a healthy and completely natural way to release sperm. There's still such stigma around this, especially for older men, but honestly, there shouldn't be. It's a normal bodily function, and there's nothing wrong with it. I tell all my patients this. Stress reduction is absolutely crucial. Techniques like meditation, breathing exercises, or yoga can help enormously. I've got patients who swear by their daily meditation practice. They say it's transformed not just their sexual health, but their overall well-being. And regular physical activity improves blood circulation and your general fitness, which all feeds into better sexual health. Your diet matters too. A balanced diet rich in antioxidants, zinc and selenium, is brilliant for optimal prostate health. Zinc and magnesium, which you'll find in nuts, spinach, oysters and other foods, are absolutely essential for sperm production. Herbal teas, particularly saw palmetto and nettle tea, have shown real benefits for prostate health. I'm not one for miracle cures, but I've seen these help many patients. Kegel exercises are worth mentioning as well. These help strengthen your pelvic floor and improve ejaculatory function. They're not just for women, you know. And healthy habits generally, stopping smoking, cutting down on excessive alcohol, will protect your reproductive health in the long run. Now, I'm often asked specific questions in my clinic, so let me address a few of the most common ones. Is it harmful not to ejaculate for a long time? Well, the body's equipped with mechanisms to handle this situation. It might cause temporary discomfort, the testicle heaviness I mentioned earlier, or nocturnal emissions. But these aren't harmful. They're your body's way of managing the situation. What happens if you experience pain from sperm accumulation? Persistent pain could indicate an underlying condition like orchitis, that's inflammation of the testicle, or prostatitis. In this situation, I'd recommend seeing a doctor. Don't try to tough it out or hope it goes away on its own. We can help, and usually quite quickly. How can you tell if sperm accumulation is abnormal? If you're experiencing pain, discomfort, or sexual problems, that's when you should consult a urologist. We can do a proper examination, run some tests if needed, and give you peace of mind. You know, one thing I've noticed over 30 years of practice is how many men suffer in silence with these issues. British Reserve is all well and good, but not when it comes to your health. I've had chaps sit in my consulting room and admit they've been dealing with discomfort for months, sometimes years, because they were too embarrassed to talk about it. That's daft, really, when you think about it. We're medical professionals. We've heard it all before, and we're here to help. I remember another patient. I'll call him David. David's 68, still working part-time as a teacher, and he came to see me because his GP referred him. He'd been complaining of urinary symptoms to his GP, but when we had a proper chat, it turned out he'd been experiencing ejaculatory problems and testicular discomfort for over a year. He'd been too embarrassed to mention it to his GP, even though his GP's known him for 20 years. Once we identified the problem, a combination of mild prostatitis and semen retention, we got him sorted relatively quickly. He kicked himself for not coming sooner. The thing is, sperm accumulation occurs naturally, and in most cases, it doesn't pose a serious health risk. But it's important to recognize the symptoms and take steps to maintain optimal health. That's what preventive medicine is all about, isn't it? Catching things early, understanding what's normal for your body, and knowing when to seek help. I've been making these videos on men's health for a while now, and I'm always happy to answer your questions. Prevention and care of male health begin with regular consultations and education. Please don't hesitate to reach out if you need individualized help or recommendations. You can find me here on YouTube, obviously, and I try to respond to comments when I can, though I do get rather a lot of them these days. And look, if there's one thing I want you to take away from this video, it's this. Sperm accumulation is usually nothing to worry about. Your body's designed to handle it. But if you're experiencing persistent symptoms, discomfort, or changes in your sexual or urinary function, come and see a doctor. Don't sit at home Googling symptoms and working yourself up into a state. We can help, and we've seen it all before. There's absolutely no need to feel embarrassed. Sexual health is part of overall health, and it's just as important to look after as your heart, your lungs, or any other part of your body. Getting older doesn't mean you have to accept discomfort or problems as inevitable. Many of the issues we've discussed today are completely treatable or manageable with the right approach. I hope this has been helpful and that I've managed to explain things clearly without being too technical. Men's health, particularly sexual and reproductive health, is something I'm quite passionate about because I've seen how much unnecessary suffering there is when people don't have access to proper information. So, please, share this video with anyone who might find it useful. Talk to your mates about it. I know that's not very British, but honestly, you'd be surprised how many of them are probably dealing with similar concerns. Take care of yourselves, all of you. Stay healthy. Don't be afraid to ask for help when you need it. And remember that getting older doesn't mean you have to put up with discomfort. Modern medicine can help with most of these issues, but we can only help if you come and see us. Right, that's me done for today. If you've found this useful, do give it a thumbs up. Subscribe to the channel if you haven't already, and I'll see you in the next video where we'll be discussing another aspect of men's health. Until then, look after yourselves.